Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California, a radio show and podcast where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Shea. Today's episode is about kindness in healthcare. The words kindness, empathy, and compassion are often used interchangeably. However, these three concepts have distinct connotations. Empathy is termed as a fire starter, a stimulus through which a person perceives, understands, and shares another person's joy, anger, or sadness. In healthcare, empathy involves putting yourself in your patient's or their family member's shoes. Empathy then motivates a person to act with kindness, a response that helps the person who receives this kindness flourish. You celebrate someone's joy with them, or recognize them for a job well done, or offer comforting words or help in times of trouble. Acts of kindness can trigger a ripple effect, a chain reaction where people feel the need to pay it forward and pass on kindness, a psychological phenomenon called prosocial contagion. Prosocial behaviors such as helpfulness, generosity, consideration, and warmth all have an uplifting effect not only on individuals who experience them, but even on people who just see them happening. So kindness in healthcare, like in other contexts, is contagious. It spreads through social networks and, with repetition, eventually creates an environment where acts of kindness become the norm. Compassion combines empathy and kindness and motivates people to do things to alleviate suffering. In healthcare, this translates to offering patients or colleagues support or guidance through difficult decisions and delivering person-centered care. Which brings us to another concept experienced by those in helping professions: compassion fatigue. This is an inability to act on compassion because of emotional or physical exhaustion from prolonged exposure to the suffering of others. These three concepts, kindness, empathy, and compassion, are interconnected, and they work together to help clinicians come to good decisions and develop trusting relationships with healthcare teams who collaborate well with each other. Healthcare environments are complex and dynamic, and perceptions of kindness and expectations of relationships and interactions in healthcare vary based on culture. But a growing body of literature shows that initiatives to promote kindness in healthcare not only enhance clinical care but also reduce stress and burnout among healthcare staff. Kindness also has a direct impact on patient experience and outcomes. In fact, there's a kindness scale in healthcare, and studies in that area find that small acts such as greeting people with a smile and actively listening is associated with a patient's perception of a physician's kindness, which in turn correlates with the patient's reported improvements in health after a visit. An initiative called Mangomoments at Leuven University's hospital in the Flemish region of Belgium showed that small, unexpected acts of kindness in clinical settings add significant value to the care experience of patients, their families, and healthcare professionals. These moments often require minimal investment of resources, time, or energy, but they result in better adherence to treatments and better healing for patients. And for healthcare staff, they result in higher feelings of accomplishment, reduced burnout, and a greater loyalty to the hospital or clinic. Our guest on today's episode of Mapping Healthcare is Professor Kris Vanhaecht from the Leuven Institute for Health Policy in the Flemish region of Northern Belgium, or Flanders. Kris led work on the Mangomoments initiative, and we talk about how it started and what keeps this effort going. The views expressed on the show are mine and those of my guests. So Kris, welcome to the show. You have a doctorate in public health from KU Leuven and are now a professor in quality management there. You're also the head of quality and safety research at the Leuven Institute for Health Policy in Belgium. So tell us, Kris, a little bit about your path to what you do now.
Thank you, Ulfat. Well, I often say that my healthcare journey started 37 years ago when I, at the age of 14, I volunteered at the National Multiple Sclerosis Hospital in Belgium, and that experience, I think, shaped my understanding of patient care. After completing my studies at university, at Leuven University, I joined the Leuven Institute for Healthcare Policy back in 1999, and today I'm still there now as a full professor, leading a dedicated team of PhD students, but also postdoc researchers. And our research addresses quality of care, of course, but we focus on quality models, also in understanding how adverse events impact healthcare providers.
So our show attracts a range of listeners. We have practicing clinicians, of course, but also trainees in health professions education listening in and members of the public. So to get everyone on the same page, let's talk a little bit about the healthcare system in Belgium so we have a shared understanding before we launch into the focus of today's conversation, which is kindness in healthcare. You've had a background where you were trained clinically as a registered nurse back when you first started in healthcare. That's over 30 years ago. And now, in addition to the research that you do, you are also the quality manager at University Hospital Leuven. So, in your work, you interact with not only researchers, but also clinicians and healthcare administrators. So, to give us some context about the clinical environment where you work, give us a really quick overview of how the healthcare system is structured and financed in Belgium, and what is the mechanism for people to access healthcare there?
So first of all, to make sure I'm not the quality manager of the hospital, we have a vice president of quality who's a medical doctor, and he has a multidisciplinary team that supports him. There are really quality managers. Officially, I'm one of the quality managers, but I'm more in an advisory role. Within the hospital, it's a very clinical environment, but it's an academic medical center. So we both do research and clinical work, and of course, a lot of teaching. If I tell you that I work in Belgium, Belgium has a population of 12 million inhabitants. We're divided into two main groups because there are two languages. There is a Flemish-speaking part of the country with the regional government, and the French-speaking side with the regional government. And of course, we have Brussels in the middle, which is both French and Dutch-speaking. I'm working in the Dutch-speaking part, so it's Flanders. 6 million inhabitants. And all inhabitants of the country pay taxes. And so we have health insurance. If I look at the number of hospitals, in total for the 12 million inhabitants, it's a little bit less, but let's say 12 million. So it's smaller than the Netherlands. We have about 100 general hospitals in the country, ranging from 250 beds up to 3,000 beds. And our academic medical center has 1,500, 1,600 beds. So that's something about the context of the hospitals. If we look at physicians, most of the physicians or the physicians in non-academic hospitals typically operate as self-employed professionals, and they are paid largely through a fee-for-service model. But the hospital funding is really complex. Patients will pay on average about 17% out of pocket. But through additional reimbursement, several groups receive additional reimbursement. So the poorer people or elderly pay less out of pocket than others. The system involves many, many detailed rules, and I can assure you that even for those working in healthcare, it is challenging to fully understand it. So there are not a lot of people in our country, the whole finance system. Most of it, everything that has got to do with money is on federal level, on national level. So we have the federal minister for social affairs and healthcare who has the money. But for example, the follow-up and the audit of quality for the hospital is on regional level. So, for example, I was today visiting the cabinet of the regional minister of Flanders to explain the work that we are doing. We have a new government, so that also the new minister and the new members of her advisors know about the work that we are doing. That's on regional level. So that's different between Flanders and the Walloon part of the country, the French-speaking side of the country. But the money is one big envelope.
Yeah, that's interesting to hear. I thought that the US healthcare system was complex, but good to see, well, not so good to see that you and I share, in addition to our interest in healthcare improvement, we also share the fact that we work in a really complex healthcare system with complex financing. So, today, let's talk about some research you've done on the impact of small acts of kindness during healthcare activities on patients and healthcare workers. Your own experience as a patient spurred some of your interest in this work. So I read that you were hospitalized, and you're pretty open with this. You were hospitalized with pancreatitis a while ago, and your experience added to your belief in this work. So tell us about your experience with the healthcare system during your hospitalization and illness.
Thanks for asking, Ulfat. I'm really open about it. I use my own case in my lectures. I show my own MRI scans to my students. They understand it, I do not, but then we can have a discussion about it. But I use it as a case because I think that my case is an average case that can happen in every hospital, with some positive points, learning points, challenges, but also some things that are not that good that we have to learn from, so positive and negative experiences. So it was back in June 21, a few years ago. I was hospitalized with a severe acute pancreatitis. Initially, it was thought to be alcohol related, but subsequent investigations revealed that it was gallbladder problems. We know 40% of pancreatitis is alcohol related, 20% we don't know, and 40% is gallbladder. So it required surgery. So on the one hand, I was happy that it was not alcohol related, although that I don't drink a drop anymore, no risks. I don't want to experience a pancreatitis a second or a third time. But throughout my hospitalization, I recorded my experiences. I've sent myself messenger messages the whole time. So I know I have a whole detailed outline of what happened, what I heard, what I felt, what I smelled, everything. And now I use this case in detail in my teaching because it illustrates areas for improvement, even in a hospital recognized for excellence with international accreditation and a lot of quality certifications. Things can go not wrong, but suboptimal. For example, they thought for 3 days that was alcohol related. So they had a kind of misdiagnose. Then they found out. But my notes also highlight really fun moments, extraordinary moments of care, small, unforgettable acts of kindness. And so it was even 3 years earlier, in February 18, that I published an article in the Lancet Oncology on the art of medicine in search of Mangomoments. And we later developed this concept through a book, and we have a video documentary which healthcare professionals now can use worldwide. It's on Vimeo, it's on our website, mangomoment.org, that they can use in teaching dignity, empathy, kindness of care. I relate to my own case to make it less theoretical.
Let's take a moment to talk about the Mangomoments initiative at Leuven University that was spurred by your personal experience with healthcare quality and obtaining healthcare. So let's first start with you telling us about a couple of key goals of this effort before we launch deeper into it.
Okay, so to be clear, we were already working on the Mangomoments stuff before I had my pancreatitis, but I'm convinced that I only really understood what it was all about by experiencing care from within the bed. I had been teaching about quality and patient safety and kindness, but it was theory. When you are a patient yourself, and I do not hope that somebody will get experience pancreatitis, but being a patient yourself, and when you reflect on that, it helps. So the Mangomoments work, we say that Mangomoments are small acts of kindness and leadership performed by healthcare workers that leave a lasting impression on patients and kin. And what is remarkable, or what is specific about these Mangomoments, is that these gestures typically require minimal time, minimal money, minimal resources. So not the big things.
So, Kris, a natural question at this point I must ask you is why mangoes? As far as I can tell, most mangoes in Belgium are not produced there, they are imported. But mangoes do have a special meaning for you and your colleagues. So tell us about that.
The initiative originated back in 2015 already, so 10 years ago, on Belgian television, where an interview with a patient, Vivian is her name. It was a patient recovering from sepsis. And Vivian woke up from a coma and started to feel better. And that is the moment that the journalist, who was staying for 2 weeks' time at the intensive care unit where Vivian was a patient, she stayed there as a journalist to observe what was happening. And she was talking with patients, with kindred professionals. And one moment, a journalist asks to Vivian, what is on her wishing list? And Vivian, she says, a mango. And that was on television. And when the journalist fulfilled this wish list, and the day afterwards she came back to Vivian with a mango, and you see it on television, and you can see it in the documentary on the website, Vivian had a really emotional response, deeply demonstrating what I think is the profound impact of the simple kindness, a stupid mango. Mango is nothing to do with Belgium. No, it's cold here. We have apples and pears, we don't have mangoes. But that was her wish. And so, inspired by that moment on television, I launched the Mango Moment research project in search of mango moments. And it was supported by Belgian Cancer Society and leading to qualitative research. We published it in the BMJ Open back in 2020. And now last year, we published a 45-minute educational video with all the details, theory, examples, but also how it works on our website mangomoment.org. There is a Dutch version of the video and also an English version of the 45-minute video.
So, as part of the patient interviews that you conducted for this research, give us some examples of the kinds of things patients told you were their mango moments. Perhaps a couple of illustrative quotes from some of your patient interviews that you could share here.
When we initiated the campaign, so we had a campaign via social media. We were in the newspapers together with Vivian. You know, she was our ambassador. She became really famous, and we opened a campaign to collect stories. And our hope was to have about 100 to 200 stories that we could summarize for educational use. But we received over 1,000 stories in 3 months' time, with approximately 950 fitting the Mango Moment criteria. My number one favorite was in a skilled nursing facility for elderly, and a nurse aide at that elderly care home during winter noticed the patient longing to feel snow. It was snowing. And so the patient said, well, it's years ago that I felt snow. So she promptly brought snow indoors. And for the bedridden residents, they could feel it. The patient explains the story. Did it cost money? No. Was it a lot of time? No. Was it fun? Yes. Will they remember? Yes. And even the most funny thing is that a few minutes later or half an hour later, they organized a photo session with some of the patients outside. And the management of the nursing home used that image for their Christmas card to the community. The second example is an example of an SLP, a speech language pathologist. She's a former student of mine. And she told me the story during her exam in quality, where she said, well, I had a patient, and during my first encounter with that patient, the patient explained me that she loved theater. So she told me I changed all the words, all the exercises that I had to do with her to get her pronunciation back, not to my random list of words that I always use, but I made up a list with all words of theater, scenario, author, actor, stage. And she told me the patient was so happy and was so motivated because I made my care specific for that patient. These are small things that clinicians can do. So the first question is a nurse aide. The second is a speech language pathologist. I also experienced my own during my hospitalization. The housekeeping staff member is the only one with who you have a casual conversation about normal things, about the weather, about what is happening. And I really looked forward to 2 p.m. because I knew then she was coming. And that was, I really knew that would be a funny 5 minutes. I did not need a lot of pain medication at that time. So very small things that we can do by everybody in healthcare. Small acts of kindness, taking time, not the big things.
So those are really poignant stories, the feel of snow when you're sick and dealing with illness indoors, and the language therapist picking words that are close to your heart, housekeeping staff taking a moment from their busy day to connect with you. Just really touching stories that can make a person's day much better. So, healthcare professionals help people during some of their hardest times, and many clinicians pick this profession and remain in it for years because it gives us the opportunity to make a difference in people's lives. So, why is trying to remind healthcare professionals to be kind or compassionate even something that you and your team felt the need to talk about in Belgium?
In the beginning of the project, when we were collecting these stories, some of the people were not positive about the project. They were saying, "Well, we are kind." They were thinking that we were saying that they were not kind. But what we learned during the project is that the most important things are so small that we as clinicians do not see them anymore. And so healthcare professionals support people during their most vulnerable moments. And although many choose this profession because of compassion, and we know that we are in a stressful clinical environment and workload pressures, we sometimes underestimate the importance of these gestures of kindness. And that was the goal of our project. Reinforcing these values was for us essential in maintaining the empathy and really as a boost of their joy in work. Ulfat.
So, Kris, when I think of Belgium, I think of chocolates. Many people do. Now I'm also going to start thinking about mangoes. So, let's stick to chocolates for a bit. You live and work in Flanders, which is the Dutch-speaking northern part of Belgium. And Flanders is often referred to as the capital of chocolate. So, what's your favorite kind of chocolate that you'd recommend visitors try in this area?
Belgium is renowned for its chocolates, of course. If you have the opportunity, visit some local artisanal chocolatier, as we call them, also in Leuven, the city where I work. Some of them are really handmade pralines, as we call them. I have two favorites. One is just normal milk chocolates. We call them mignonette. It's excellent with your cappuccino. It's super. But the other favorite is a layer of milk chocolate topped with coffee cream and with a layer of white chocolate. And I really like that, not only because it's really nice, but that praline has a specific name. And the name of that praline is Manon. And that's the name of my daughter. And so maybe I'm a bit biased with that chocolate, but that is my really favorite, the Manon praline.
That's beautiful. And tells me you love your daughter a lot, at least as much as you love chocolate.
And my son.
And your son. All right. So thanks for those suggestions. I'll be sure to put those on my list of things to try when I'm in the area next. What I've done is I've put eat chocolate at the top of my list of things to do today, and that way at least I'll get one thing done today. And those are all the questions I have for you today, Kris. Thank you so much for joining me on Mapping Healthcare. And I really appreciate the work that you do to remind healthcare professionals about these not so random acts of kindness that really brighten a person's day for the better. So thank you, Kris, for all your work, and especially the conversation we're having today about the Mangomoments initiative.
Thank you, Ulfa, for the opportunity. It was my pleasure.
So that was Professor Kris Vanhaecht telling us about his research on the impacts of small acts of kindness during care activities on patients and healthcare workers. We heard how kindness is contagious and civility saves lives. All right, that's all I have for you today. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM, where we explore healthcare around the world, highlight people who improve it, and share what we can learn from them. This episode featured music by Bazaar. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts.
Wie had je willen zijn toen ik even niet keek? Het is de denk maar niet aan morgen, elk eind een nieuw begin. Als we weten wat het wordt, waar heeft het dan nog voor zin? Oh, denk maar niet aan morgen, neem mijn herinnering. Als we weten wat het wordt, waar heeft het dan nog voor zin? Wat heeft het dan nog voor zin?